So, hi everyone, I'm here with Ken Johnson, and Ken has a lot of professional experience that can add to our conversation today. So, I'm just going to ask him to introduce himself and tell us a little bit about his experience and his professional life.
Certainly. Hello, I'm Dr. Ken Johnson. I've been working as a clinical psychologist for about almost 30 years, 25 to be exact, but 30 if we count the internship. And I appreciate Pastor Charlie asking me about some mental health concerns. My wife and I both have been doing this practice. We're both supervisors in the state. We both have a certified addiction background as well. And so comprehensively, we cover most of the clinical issues that mental health concerns need to be addressed in our practice.
Okay. Ken, we're talking today in our church service about the problem of suicide, and that's something that seems to be much more prevalent in our society and our nation in these days. I mean, am I correct about that? And if I am, what do you think is behind some of that?
Actually, you are correct in that. We have seen a rise in suicide in the past 20 years. If we start at 2002, what we've seen is almost could be considered an epidemic proportion. We've seen a steady rise in suicide across the board from adolescents to the elderly population, 3 to 5%, reaching a significant amount of our population in this past year.
So, I mean, it's clearly a problem on the increase. We are one little church community in a small town here in the northeast of Florida. What can churches like ours do to be helpful with those who are struggling with notions of suicide?
Right. It's a very good question, Pastor Charlie, and I appreciate you asking that, and I appreciate our church taking a look at that. Suicide is not a criminal activity. It's actually a mental health concern. Approximately 47 to 55% of the people who complete a suicide have a mental health problem. And part of the stigma with the mental health concern is that people will not reach out for help. And so a church body, a church like this and other churches in the community, being willing to ask the question, being willing to be a place of hope and help, not to scrutinize or minimize someone's concern, but to certainly open the door and say, we are here to help in some way, shape, or form.
So really, you talked about the stigma around this in our society. It's really communities like ours can do what we can do to try and overcome that stigma by being willing to have the conversation like we're doing here today, right?
Absolutely. An open conversation, willing to go into some of the hard places too, because when someone says they feel like they're taking their life, that can be quite scary for the person saying it as well as the person hearing it.
Sure.
And to not be afraid of talking about the mental health concern, the whether it's a health condition, a loss of a family member, a drug and alcohol problem might be existing, being willing to engage the duress that another individual is experiencing is a way to say, we want to help.
Gotcha. Ken, you told us you've been a professional for 25, 30 years in this area. I assume you've worked with many people who have struggled with these kind of thoughts.
Right.
Tell me a little bit about how your faith impacts your professional practice.
Well, one of the things about having a faith and belief in Jesus Christ is really that I feel, and I understand this, is I have the ultimate hope. And paramount for doing psychotherapy and helping with people is being a conduit for hope. Being able to bridge that gap and establish a relationship and let someone know there is hope available. Now, as a clinician, my primary job is mental health and addressing the clinical health concerns. So I'm not a pastor. However, should spirituality or faith come up in session, I would be happy to engage the individual in that. But that's where the church can really come in, because that's the church's mission, letting others know that we have ultimate hope in things that we are afraid of or want to get away from or want to move toward a different lifestyle than where one may have been. And oftentimes, suicide is a dark place for people.
Gotcha.
And so being a receptive, open household, church body, and if you don't know, certainly feel free to reach to somebody else in the congregation to say, we can direct you here, direct you there.
Gotcha. Ken, thank you so much for taking the time today to come and talk to me about this. We appreciate you. We appreciate your professional life and your ministry in our community. Thank you so much.
Thank you, Charlie, for asking.